The role of specifically autologous stem cell transplantation in peripheral T-cell lymphoma is controversial. Where the controversy arises is patients who achieve complete remission, after chemotherapy, so CHOP or now brentuximab vedotin plus CHP, should they get in consolidation an autologous stem cell, a high-dose chemotherapy with autologous stem cell transplantation? There's numerous studies addressing this, but no randomized study that addresses this question, so we do not have a definitive answer, and I think it kind of depends on where the patient's referred, who's seeing them. In general, most phase 2 studies and retrospective studies show better outcomes with autologous stem cell transplantation in CR1 when you compare to controls that did not receive autologous stem cell transplantation. But there's huge amounts of problems with this data. It's biased. I mean, if you can get a transplant, you're more fit and going to do better probably no matter what. And again, when you're analyzing the literature of autologous stem cell transplant in CR1 for T-cell lymphoma, it's all about the population enrolled. So, anaplastic large cell lymphomas that are ALK positive do really well, and in some of the earlier studies, those were included in the transplant studies. It's now universally kind of accepted that you should not transplant ALK positive in CR1, but some of the data still has that population. So I think it's an evolving question, and it even gets harder. Now if you get a CR1 after brentuximab plus CHP, you see better outcomes with that population, but do we still need transplant? They looked at this question in a subset of the Echelon 2 data, where they looked at the patients who got transplant in CR1 and brentuximab, and those patients did extremely well. I think progression-free survival was somewhere around 70 to 80%, which is unheard of in that. But again, that data is a subset of a subset that's extremely susceptible to lots of biases. So I don't think we know the answer. My practice has generally been to discuss the pros and cons and really take it on a case-by-case basis with the patient.